Hello everyone, my name is Elisa. Today we are talking with Dr. Rita Jerath. She is MD, dermatologist and cosmetologist. It's about scar removal. Should we start?
Sure.
What causes scarring?
Scarring is part of body's natural healing process when a tissue is broken down. After the tissue is damaged, a special protein called collagen is released, and this collagen builds up to strengthen and heal the wound. And that's why scarring happens.
How do people get scars?
People can get scars from various reasons. For example, if they have had an accidental injuries, or fire injuries, electrical burns, or they can develop naturally also, like in the form of keloid, without any reason. Any stretching on the skin, like in pregnancy we get stretch marks, they are also a part of scar. So these are the various methods by which we get scarring.
What are the different types of scars?
Depends on how deep the scar is. If the scar is very superficial, like just laceration or accidental scars, just touching the surface of the skin, then there may be just hypopigmentation. But if the scar is deep, it can lead to contractures, it can lead to keloid, it can lead to hypertrophic scars, where many layers of the skin are attached to each other, and contractures also.
What treatments are available?
There are lots of treatments are available depending on the depth of the scar. There can be some topical medication, anti-scar creams, or we can have injections which are injected deep down into the scars, like in keloids. Injections of steroids are given so that to flatten out the scar. In hypertrophic scars also we can give injections of steroid. Then we have other procedures, laser procedures like radio frequency, microneedling. I mean, it depends mostly on the type of scars we have. Like in post-acne scars, we give microneedling, and we can do PRP. And finally, in contractures and burn scars, we can do surgical procedures also.
What is scar revision?
Scar revision is basically a mode of treatment to improve the quality of the scar. Although scar cannot go permanently if it is deep, but we can certainly change its appearance, and that is called scar revision.
At what age can scar revision be performed?
Scar revision can be performed at any age, but when it is stable. If it is growing scar, just like in keloids, it keeps on coming, keeps on growing. When it is stable, then we can do the treatment for it.
What does a typical scar revision consultation entail?
Yeah, it depends on how old the scar is, how deep the scar is, how much area of the body is involved, and what is the type of procedure the patient is expecting, what are the results the patient is expecting. That has to be told in consultation, and how much improvement we can give the patient.
How is laser scar revision performed?
Laser scar revision is performed with carbon dioxide laser, fractional laser, that removes the upper layers of the skin, and from below it stimulates the collagen so that the next skin which comes, it is a bit more healthier and good looking.
What should one expect after the procedure?
Well, there is some downtime in this procedure. You have to take light dressings, occlusion with silicone sheets, that can be done for 5 to 6 days, and depending on how much area is involved, it can take some time to heal the scars, and the visible changes can be seen immediately after 1 to 2 days, but complete results will take at least 1 year for development.
What are the risks of scar revision?
But the risks of scar revision can be a reaction to anesthetic agents. You can develop infection post-operatively, and there can be keloid formation. Like if a patient has a tendency to keloid formation, then they can reoccur, and there can be some darkening of the area which you have treated.
Are scar revision results permanent?
Yeah, most of the scar revision treatments are all permanent except for keloid. It can appear again and again.
What are the alternatives to laser scar revision?
Except from lasers, you can go in for microdermabrasion, microneedling, radio frequency, and then, of course, the surgical modalities are also available.
Thank you, doctor, for the information. So, if anybody wants to take an appointment, they can contact numbers mentioned on the screen, or else they can contact through our website.